So welcome everyone. We're super excited to have you online with us today. I am very pleased to introduce our speaker. Her name is Meghan Benson. She's coming to us from Planned Parenthood of Wisconsin, and she's the Director of Community Education. She's here to talk about sexual and reproductive health considerations, and we hope you enjoy. Thank you. Wonderful. Thank you very much, and thank everyone for listening in. So we are going to get started talking about some different sexual and reproductive health issues that are important to think about when we are working with victims and survivors of sexual assault and intimate partner violence. So quickly, a few things about Planned Parenthood, just so folks are aware. We do have 22 health centers around the state of Wisconsin where we provide annual reproductive health exams, a variety of different methods of birth control, including many of the methods that I'll be talking about today, as well as emergency contraception, or EC, and condoms. We also provide breast and cervical cancer screening, STI, or sexually transmitted infection testing and treatment, HIV testing, pregnancy testing. And we are very excited that very recently we just started online appointment scheduling, so you can send folks straight to our website, ppwi.org, and directly schedule an appointment there for any of those services that I just mentioned. Additionally, we do provide abortion services at 3 of our health centers, one in Appleton, one in Madison, and one in Milwaukee. We also provide referrals for many other health and social services for our patients. We do provide education and training, including direct education for youth and parents through schools and community organizations, as well as trainings for professionals. And then finally, we do also community organizing and advocacy, so we can make sure that policies are in place that allow us to provide the health services and education services that I just mentioned. All right, so our objectives for today are to explore sexual and reproductive health outcomes and disparities in the United States and Wisconsin specifically, list intersections between sexual and reproductive health and experiences of interpersonal violence, explain the core components of a reproductive life plan, which is a useful tool for supporting sexually healthy behaviors, including the use of birth control, and describing special considerations for victims of sexual assault and intimate partner violence when accessing sexual and reproductive health services. So we are quickly going to watch a video from the Contraceptive Choice Project, which is a research project based out of St. Louis, where over the course of many years they enrolled thousands of women in this study, provided them with any method of contraception that they would like to use, and then did some research around those different methods of contraception to try to just figure out what works best for women, what kind of choices we need to offer women in terms of planning their reproductive lives.
Women have many paths available to them. How far to pursue an education, what career to choose, how to save or spend money, whether or not to marry. But an unplanned pregnancy can cut off those pathways. Unintended pregnancy affects women and men of all ages and income levels. Teen mothers are less likely to complete their education and tend to end up or stay in poverty. Women may have to put their careers on hold. Families suffer financially, and unplanned babies are more likely to have low birth weight and other health issues that can affect them their whole lives. Unintended pregnancy has national consequences. Half of all pregnancies in the United States are unplanned. That's 3 million unplanned pregnancies a year. And U.S. taxpayers currently pay $11 billion annually to cover unplanned births. But not all unplanned pregnancies are followed by birth. More than 40% end in abortion. That equals 1.2 million abortions in the United States every year. Why do we have this problem when birth control is available? Some women don't have health insurance or have plans that won't cover birth control. Some must weigh the monthly expense against college textbooks or even against the electric bill. Other women don't follow the rigid schedules required by the pill, patch, and ring. In the real world, these methods have a 9% failure rate, and for women under 21, the risk doubles. If we all have a shared goal of reducing unplanned pregnancy and abortion, it's time to look at what really works. Long-acting reversible contraception, otherwise known as LARC, is safe, easy to use, and highly effective. LARC methods include IUDs and subdermal implants. Because they don't require anything of the user, such as taking a pill at the same time every day, LARC methods have an extremely low failure rate, less than 1% of users. In real-world tests, LARC methods were 20 times more effective than the pill, patch, and ring. But fewer than 10% of American women actually use them. Why is that? While some women can't afford the initial cost, most women simply don't know about LARC methods. Often, healthcare providers just offer the pill, which cuts off a woman's options. She can't take a path if she doesn't know it's there. Things could be different if more women were aware of LARC methods. The Contraceptive Choice Project in St. Louis provided 9,256 female participants with education and access to all birth control methods at no cost. Without knowledge or cost barriers, 75% of choice participants chose LARC methods. And because the majority of women in choice use the most effective methods, their unplanned pregnancy rate was only 35 per 1,000 women. Compare that to the national rate of 52 per 1,000 women. And remember those 1.2 million abortions? That's the same as the national rate of 20 per 1,000 women. Choice participants had an abortion rate of only 6 per 1,000 women. If women nationwide had access to LARC methods, we could potentially prevent up to 1,060,370 unplanned pregnancies and 873,250 abortions every year. If we're serious about reducing unintended pregnancy and abortion, we need to be serious about doing what's been proven to work. Women need education about LARC methods, access to the birth control method that works best for them, and a way to get contraception at an affordable cost. Who knows what could happen when those pathways to education, work, and financial stability stay open? The possibilities are endless. You can help women stay on the path they've chosen. Please, pass this video on.
Okay, so as the video just mentioned, many pregnancies in the United States are unintended, and so we want to talk quickly about why the intent of pregnancy matters. So first of all, women who experience unintended pregnancies are more likely to delay prenatal care. They are at greater risk of physical abuse from an intimate partner while pregnant. They have higher rates of negative health outcomes during as well as after pregnancy. And the children who result from unintended pregnancies are more likely to have poorer physical and mental health outcomes. It's really important to keep in mind that just because a pregnancy isn't intended, that does not mean that the child is not wanted or doesn't grow up cared for and loved, but it is just important to recognize that when people are not intending to get pregnant and do get pregnant, there are many more barriers that they may be facing. So as the video mentioned, about half of all pregnancies in the United States are unintended, and this statistic has stayed very consistent for decades. And when you break this down, what this looks like is about 30% of those pregnancies are mistimed, meaning the woman wasn't planning to become pregnant at the time that she did, but wanted to at some point in the future. And almost 20% of those pregnancies are actually unwanted, meaning the woman did not want to have children, or she was done having children. She really did not have any intention of becoming pregnant at any point in the future. So when we're talking about unintended pregnancies, many of them are mistimed, but certainly there is a fair portion of them that are also unwanted pregnancies. And nearly 50% of all unintended pregnancies occurred in the months that couples used a method of contraception. So what this means is that many people are trying to prevent pregnancy. They may feel like they are preventing pregnancy, they're doing things to prevent pregnancy, but perhaps they're not using birth control correctly or consistently enough, and still we see those unintended pregnancies. And so that's why it's really important to discuss birth control with women as well as men and couples so that those pregnancies are more likely to be planned. In terms of sexually transmitted infections, many infections are actually easily cured or treated, but may not have symptoms. Things like gonorrhea and chlamydia, which unfortunately we're seeing a continued increased rate of those infections in Wisconsin as well as across the United States. Many individuals, in particular women, may not have symptoms, but nonetheless are still infected, potentially passing those infections on to other people. And long-term infections, if left untreated, can lead to a lot of severe health consequences, including things like infertility. So it's just really important that we're reminding folks who are sexually active, who may be putting themselves at risk for sexually transmitted infections, of the importance of getting tested, probably at least annually, but maybe more often, and they should really consult their healthcare provider to determine how often they should be accessing treatment. Additionally, another really great resource that we have access to here in Wisconsin is expedited partner therapy. So if someone comes into a health center, including a Planned Parenthood health center, tests positive for certain types of sexually transmitted infections, but their partner is not willing to come in and get tested and treated, we certainly know that that partner could easily turn around and transmit that infection right back to their partner if their partner gets cured. So we do provide expedited partner therapy where we provide the medication to the partner who is in the health center for their other partner in hopes that we're really going to decrease the incidence of sexually transmitted infections in the state. One other thing to mention, April is Get Yourself Tested Month. Most Aprils we are able to do free testing at Planned Parenthood health centers, and so we certainly encourage folks to check that out when it gets close to April. Hop on our website, ppwi.org, to find out more about testing and our health center locations. As I mentioned, some of these infections, when they aren't treated, can cause serious long-term health consequences, so we are encouraging folks to definitely come in and get tested. And also, as I mentioned, we are seeing those increasing rates across the country. Now, something we're particularly concerned about are disparities that we see in sexual and reproductive health outcomes, and we see those disparities across the board. We see those when we talk about unintended pregnancy, when we talk about abortion, sexually transmitted infections, HIV, infertility, reproductive cancers such as cervical cancer, and much more. And so certainly this is a big problem that we want to address. Those communities that are most impacted by these disparities include youth, women, people of color, low-income individuals, LGBTQ+ individuals, and so these are particular communities that we may want to focus on when we are working on reducing negative sexual and reproductive health outcomes. So, for example, we see some pretty large racial disparities in Wisconsin's teen pregnancy rates. These rates are per 1,000 teens. So as you can see, the teen birth rate for African-American teens in Wisconsin in 2011 was a little bit over 60 per 1,000 individuals, whereas the overall teen birth rate is just a little bit above 20 per 1,000 individuals. And certainly we see also disparities with Native American, Latina, and Asian American populations as well. In terms of sexually transmitted infections, again, we see some pretty significant racial disparities, in particular here in the state. So you can see kind of the disease burden for reportable sexually transmitted infections in the state, which includes things like gonorrhea and chlamydia. And as you can see, even though African Americans make up a much smaller percentage of the population in Wisconsin, they bear almost the same disease burden as white individuals in Wisconsin. So certainly a big racial disparity that we see there. So to transition a little bit, we talked a little bit just generally about sexual and reproductive health in Wisconsin, some of the pretty severe and significant disparities that we see here in Wisconsin. And I'm wondering if folks can just take a minute to think how experiences of sexual assault and or intimate partner violence intersect with sexual and reproductive health outcomes, including some of the ones that I just mentioned. A few things that may come to mind is certainly sexual assault may put a woman at risk for pregnancy or sexually transmitted infections. Reproductive coercion is often a tool that is used in abusive relationships. So one partner controlling birth control decisions, controlling pregnancy outcomes are behaviors that could be described as reproductive coercion. And then in particular, as people move forward after experiences of interpersonal violence, we need to support not only the physical and emotional healing, but also planning for a healthy and hopeful future. That includes decisions about sex, relationships, sexual and reproductive health care, pregnancy, and parenting. And again, it is important to incorporate all of those aspects into someone's future plans when it comes to their health and well-being. This is a study that came out a little bit earlier this year. It was done by the Contraceptive Choice Project, again, the folks in St. Louis who put together the video that we watched at the beginning of this presentation. So as I mentioned, they enrolled a little over 7,000 women of reproductive age, so between the ages of 14 and 45, between the years of 2007 and 2011. They have continued to follow up with these women to better understand their experiences with contraception, including the intersections of other experiences in their lives. So similarly to what we see in the general population, about 1 in 3 women in this study have experienced emotional, physical, and/or sexual abuse in their lifetime. So that could be either as a child and/or as an adult. So what we found is that the women who had these experiences of interpersonal violence during their life were as likely as women who had not had experiences of interpersonal violence to choose a LARC method. If you'll remember from the video at the beginning, the LARC methods are the long-acting reversible contraceptives, including IUDs and the implant, which have found to be highly, highly effective at preventing unintended pregnancies. So we know they're just as likely to choose this method. They're slightly more likely to choose other methods of contraception, including the patch, the ring, the injection, which is also sometimes called depo or the depo shot, than the pill. And really importantly, I think it's important to look at these last 2 bullet points. What the study found is that women who have these experiences of interpersonal violence are much more likely to discontinue any method of contraception that they choose. And certainly when women discontinue their method, there's always that risk there of unintended pregnancy. So we see these higher rates of discontinuation with the IUD and the implant at 17% versus 14% of those who haven't had those experiences of interpersonal violence. But then with those other methods, the things like the patch, the ring, the pill, the depo shot, we see really significantly higher rates of discontinuation. We see higher rates of discontinuation in both groups, but in particular with those who have experienced interpersonal violence. Within about a year, 56% of individuals will stop using their non-LARC methods of contraception. Again, this is a concern because when women stop using contraception, they are at risk of unintended pregnancies. So certainly this is something that we want to consider as we're working with individuals who have these experiences of lifetime violence. We maybe don't exactly understand why we see these differences right now, but we are seeing these differences, and the study is continuing to explore how we can provide better prevention and intervention for all sorts of individual women, including, again, these women who have had these experiences in their lifetime. All right, so one really great tool for talking to anyone, and that includes women as well as men, as well as adolescents, about contraception, birth control, preventing unintended pregnancies, and hopefully planning pregnancies if people do want children in their future, is to use reproductive life planning. So what exactly is a reproductive life plan? A reproductive life plan is an assessment of an individual's own goals in terms of childbearing and where childbearing fits into their lives. So some things folks might want to take into consideration when they're developing a reproductive life plan is their educational goals. Does someone want to finish high school? Do they want to go to college? Do they want to go to a technical school? What are their educational goals, and how does childbearing fit in there? How could it potentially create a barrier to successfully achieving these educational goals? And then also work and career. If a career is something that someone is looking for, certainly it's important to consider how childbearing and parenting could, again, create some barriers, and how folks can work to figure out when would be a good time in their lives to have children, if they even want to have children. And then thinking about the future. In particular, you know, if you're working with somebody who doesn't have any children, you might want to ask the question, do you ever want to have children, and start there. For folks who already do have children, it's still important to create a reproductive life plan for moving forward, thinking about future children. If somebody wants children in the future or not, when, how many, how much time do they want to put in between their children. All of those kind of questions are very important as well. And really the goal of developing a reproductive life plan with someone is to create a plan that supports that individual and the goals that they've identified as important to them. So the reproductive life planning assessment, again, is very client-centered. It's based on the client's values, the client's goals, the client's life and experiences. It can be very empowering for a client because you are asking them to create the plan that's going to be best for them. You're really trusting that individual to be the expert on their own lives. And certainly professionals have a role in helping to guide the development of a reproductive life plan, but ultimately the power really lies with that individual to follow through with that plan so that hopefully they can achieve some of those goals that they've set for themselves. It includes some key basic questions. Really, it's at the bottom line, it's 3 basic questions that you're going to ask the individual. But these questions do allow the client potential to explore and elaborate on their goals and their feelings and their beliefs about the future. Reproductive life planning, again, invites this goal setting. It's a very important aspect of the reproductive life plan, and then developing action steps to hopefully fulfill those goals. For folks who are familiar with motivational interviewing can be a really good tool to use when helping someone develop a reproductive life plan. And something that's really great about a reproductive life plan is it can actually be a pretty brief conversation. I know many folks are pressed for time. Often when we're working with clients or patients or education participants, we have a lot that we need to get through, a lot of information that we need to deliver, and sometimes there's not always time to talk about things like planning pregnancies and birth control. But again, the reproductive life planning assessment can actually be done pretty quickly. Certainly if you have more time, it could be a very long conversation with an individual, but if you're pressed for time, you can do this pretty quickly. So these are the 3 basic questions when we're talking about developing a reproductive life plan with someone. So the first one is, do you want to have a baby, or do you want to have another baby if you're talking about someone who is already parenting? Are you having sex, in particular the type of sex that can get you pregnant? And is there a chance that you could get pregnant or get someone else pregnant? And if you don't want a baby right now, what are you doing or planning to do to keep yourself from getting pregnant, or again, keep a partner from getting pregnant? So really, again, can be done pretty quickly and pretty briefly if you only have a short amount of time to just start thinking through these questions with a client or a patient. So I do quickly want to talk about some different methods of birth control. And I first want to point out that the most commonly used method of birth control is the pill. I don't think that would surprise people. It's probably one of the methods of birth control that's been around the longest. And so certainly we do see a lot of people continuing to use the birth control pill. It can be very effective. When it's used perfectly, it's about 99.7, 99.8% effective, very, very effective when used perfectly. But let's face it, it's really hard to remember to take a pill every day around the same time every day. And so typical use rates with the pill, we see it being about 92% effective, which means that over the course of a year, if we had 100 women using the pill regularly, like normal people do, about 92 of those women are going to be able to prevent pregnancy, but 8 of those women will still end up pregnant. So that is important to keep in mind, that with that typical, regular, everyday use of the pill, it can be a little less effective just because people have trouble remembering to take their pill on time. So after the birth control pill, the next commonly used method of birth control is a condom. So certainly that can be really great because a condom is one of the few methods of birth control, in fact the only other than abstinence, that can also prevent sexually transmitted infections. And so certainly using a condom can be a really great way of preventing transmission of sexually transmitted infections, although it is not quite as effective as some of the other methods of birth control. So we often also encourage folks to use dual methods of birth control. So maybe a slightly more effective birth control method along with the condom is going to provide tons of protection against pregnancy and also a lot of protection against sexually transmitted infections. So interestingly enough, I think this might surprise some folks, or maybe not. The third most commonly used method of birth control is withdrawal. I will say that there is some research out there that demonstrates that in adult couples, so these are folks who have some kind of long-term relationship, research has found that the withdrawal method can be effective. The effectiveness rates really vary across the board in this research, so anything from about 60 to 90% effective. And certainly, the withdrawal method could be effective if that's the only option that someone has, if they're going to have sex regardless of whether or not there's a condom there, and they can utilize withdrawal. We do know it does have some effectiveness against pregnancy, but clearly there are a lot of way more effective methods out there that we would certainly like to educate folks about, just so that they know that they have other options that are perhaps a little bit more dependable. And then one other thing I want to point out on here, you can see the IUD or intrauterine device, which again is one of those long-acting reversible contraceptive or LARC methods. You can see a little bit more than 6% of women are using that as their method. I will say the IUD is one of the most effective methods out there. It is, more than 99% effective, not quite 100, but more than 99% effective all the time. So that's with perfect use or with typical use, because we really don't have any user error with the IUD. Once it's in place, it's in place. They can be left in for between 3 and 10 years, depending on the type of IUD it is. And 5 and 10 years, depending on the type of IUD it is, and you have that more than 99% effectiveness rate all the time. So that's interesting that one of the most effective methods of birth control is actually one that we see being used significantly less. And then you can take a look at the next chart. So this is what women believe. So the first one was what women are using for their method of birth control. The second chart is what women believe are the most effective methods. As you can see, abstinence is at the top, and certainly if folks are using abstinence correctly and consistently, it will be the most effective way of preventing pregnancy. But if people are choosing to have sex, there are a lot of other effective methods. As you can see, many people think the pill is one of the most effective methods out there, which, as I just told you guys, isn't true. It can be very effective when used perfectly, but really things like the IUD and the implant are much more highly effective methods of birth control. So you can see from this chart, these are where all the different methods kind of lie in terms of typical use. So again, this is just your regular, everyday kind of person using birth control. Some of them we find to be significantly more effective than others. Again, the IUD and the implant, very effective and reversible. The other two methods of birth control that are listed under the most effective forms are vasectomy and female sterilization, which again, more than 99% effective. However, in many cases, they can't be reversed. So if we're talking about a young person who maybe hasn't had children yet, isn't ready for children, but is thinking they might want children in the future, and if it's 3 years or 8 years or 10 years, IUDs and implants can be a really, really great option because they do last for a very, very long period of time. And clearly there are a lot of other methods up here that folks may choose to utilize. The pill, the ring, the patch, depot, they're all still very, very effective methods of birth control that women may choose to use for different reasons. And then you can kind of see the decreasing effectiveness of some of these other methods. And this is just another chart to put that into perspective about what some of the most effective methods are, and then some of the less effective methods towards the bottom. So on that chart that we just looked at, if folks have a chance, and we can go back in just a second, think about the different methods of birth control that you would discuss with a client immediately following a sexual assault. So I'm thinking that one of the methods someone may have hopefully circled or thought about is emergency contraception. Emergency contraception can be used up to 5 days after unprotected sex, and potentially taking it even 6 or 7 days after unprotected sex may still provide some protection. But if someone has, if you're talking with someone who has recently been sexually assaulted, if there's a concern with pregnancy, it is probably very important to be having a conversation about emergency contraception, and I'll be talking about emergency contraception just a little bit more in a second. Next, I'm going to go back to the chart, and I just want you to think about the different methods of birth control that you might discuss with a client who is in an abusive relationship and for whatever reason is just not able to leave that abusive relationship yet. So think about the different methods that you may talk about with a client who's in that situation right now. All right, so for this one, I'm thinking some folks may have also thought about emergency contraception. I know there are some folks who are more and more talking about emergency contraception during the process of safety planning. So if something happens to another method of birth control, if a pill pack gets thrown out, if condoms keep on breaking, whatever the situation might be, making sure a woman knows about her access to emergency contraception in those situations could be very important. Some other methods that folks may have selected or thought about might be some of those more invisible methods, so the methods that a partner couldn't necessarily see or throw away in the garbage or something like that. And in particular, I know folks oftentimes come up with things like the IUD or the implant, and we will be talking about those a little bit more in a second. So with emergency contraception, over the past year, some studies have come out to show that some different methods of emergency contraception might work better for certain women. So if you take a look at this chart, these are the 3 different methods of emergency contraception that are available right now. The one that folks are most familiar with is probably Plan B on the right-hand side. Plan B is just basically a really high-dose method, or a really high-dose birth control. And there are some other similar brands out there. Next Choice is a generic version, and I believe there are some other generic versions out there as well, but again, these are basically just a really high-dose birth control pill, and they work the same way that birth control pills do. They prevent ovulation, which is the main way that they're able to prevent pregnancy. In the middle column, you'll see Ella. Ella is also a medication. It's a pill that someone takes within 5 days of unprotected sex. It's a slightly different type of medication than Plan B, but it actually works in the exact same way by preventing ovulation in hopes that we can prevent pregnancy even after sex, because hopefully, as folks know, pregnancy doesn't happen immediately after sex. It can take a few days for those sperm to make their way up to the fallopian tubes. So we do have some time after sex to prevent ovulation, and Plan B and Ella can both be very effective at doing that. And then in the left-hand column, you will see the Copper T or Paragard IUD. So basically what this is it's an emergency insertion of an IUD. And one really great thing about this is, well, first of all, it's very highly effective. It's actually the most effective method of emergency contraception up here. But additionally, if a woman is looking for an ongoing method of contraception, once the Copper T IUD is in place, it can be left there for up to 10 years and provide more than 99% protection against pregnancy. Certainly, it can also be removed at any point that the woman would like, but that can be really a great option for some women to have that ongoing method of birth control. So you can take a look at this chart, and again, you can see that the Copper T IUD is the most effective. Ella and Plan B are both effective as well. The biggest concern is that women who are a little bit more overweight we do see that Plan B is less effective and at some point may become ineffective in very overweight women. So if women are a little bit more overweight, Ella may be a better option for them. Women who are significantly overweight, Plan B and Ella just may not work for them. However, the copper T IUD is an option for any woman, and again, could be a really great option for somebody who is looking for that ongoing method of birth control. So just to break things down a little bit more, this chart kind of shows you copper T IUD. It's effective for all women, regardless of body size. For Ella, it's going to be a little less effective, still effective, but less effective in women with a BMI over 35. Plan B is going to become less effective in women with BMIs between 25 and 30, and may not work actually at all in women who have BMIs over 30. So with women who have BMIs over 30, healthcare providers should really talk to them about Ella and copper T as options. And then as we're thinking about some of the other methods of birth control that I suggested folks may have brainstormed when we're talking about women who are currently in abusive relationships and unable to leave but are still looking for a method of birth control. Now, a couple things to consider are going to be visibility. Many methods of birth control are very visible. With pills, you have a pill pack laying around somewhere, which certainly someone could find and unfortunately throw away or do something like that. Other methods of birth control, even things like the patch, which clearly sits on the skin, could be visible. So certainly it's important to think about the visibility of a birth control method when talking to a woman who is experiencing reproductive coercion in a relationship. Next, thinking about the schedule. So again, with the pill, it's something you got to do every day. The ring, it does need to be changed once a month. So again, there's going to, you're going to need to keep those extra rings somewhere, and you may not want a partner to find those. There are many methods of birth control that you maybe only have to go to the doctor one time for, though. So something like the IUD or the implant, and even something with like the depot shot, which you have to access. You have to go to the health center about once every 3 months to get. Kind of depending on a woman's situation may depend on whether or not that's feasible for her. So just keeping in mind that different methods of birth control have very, very different schedules. Next could be accessibility. So again, with the depot shot, if a woman needs to get to the health center once every 3 months and she lives in a really rural area, has limited access to transportation, that could certainly be a challenge for her and something that may need to be considered when figuring out which method of birth control would be the best choice for her. Something else to consider is side effects. So I know I've mentioned a couple times now about utilizing the long-acting reversible contraceptives for women who might be in this situation. Again, because they are long-acting once they're there for years, and they do tend to be pretty invisible. However, it's important to keep in mind that both the implant and two types of IUDs that are available right now, the Mirena and the Skyla, they contain progesterone, which can cause irregular bleeding in some women. And in fact, most women will have some irregular bleeding at first, although in many women that tends to go away. And actually, after about a year of using a progestin-only birth control method, many women do stop getting their periods. So it's important to counsel women that if they choose the Mirena or Skyla IUD or the implant, they may have that irregular bleeding and then eventually no bleeding. Certainly there are some partners out there who may monitor bleeding and who may notice these changes. So it's, again, just important to have this conversation with women as they're trying to choose the method of birth control that's going to work best for them. So the other type of IUD that's out there that I also mentioned can be used as a form of emergency contraception is the copper T or Paragard IUD. It does not contain any hormones, so it does not have the same effect on bleeding patterns that those other methods that I just talked about do. However, when women do get the copper T IUD inserted at first, it can cause some heavier or more painful periods for a while. So again, there may be some slight changes in the woman's bleeding pattern. She may bleed a little bit heavier for a while, and again, unfortunately, sometimes there are partners who will notice that. So just one more thing to make sure that you're talking about when you're having conversations with women about different birth control methods. Oh, and one other thing that I wanted to mention about the copper T IUD or the Mirena or Skyla IUD, something else that is helpful when it comes to thinking about visibility is that healthcare providers can actually trim the string that's attached to the IUD that hangs out of the cervix. They can actually trim that string inside the cervical canal so that the string can absolutely not be felt by a partner. Generally, partners do not feel the IUD string, but there is a chance that that could happen. And so if there's a concern about that, a woman could talk to her healthcare provider about trimming that string again in the cervical canal. It does make it a little bit more difficult to take the IUD out. The woman would have to have an ultrasound in order to have the IUD removed, but many healthcare providers are able to offer that to women if it's something that they really need. So something else to keep in mind is that some of these methods that I've been talking about, in particular the LARCs, very effective against preventing pregnancy. Oftentimes very hard to see or notice that a woman's using them. However, they don't offer that additional protection against sexually transmitted infections. So again, it's just another piece of information that you would certainly want to share with a woman, that if there's concerns about sexually transmitted infections there, most methods of birth control aren't going to work, and certainly those kind of invisible methods that we've been talking about. And there are also medical contraindications to using different methods of birth control. All of these methods of birth control, with the exception of condoms, spermicide, and emergency contraception, a woman is going to need to go to a healthcare provider to get access to. So certainly the healthcare provider will discuss with her personal and family history to make sure that whatever method of birth control she utilizes will be safe and healthy for her. And then finally, personal preferences. Everybody has personal preferences. You know, they can adhere to those schedules differently. They have different comfort levels with their body or with those kind of side effects around irregular bleeding or perhaps even not having a period at all. Everybody has personal preferences, and it's certainly important to take those into consideration when talking to a woman about different methods of birth control. And that's part of the reason we have so many methods of birth control available to women, is because no one's the same. We're all a little different, and those personal preferences will certainly play a role in not only the choice of birth control, but in also the continuation of that birth control method. It's really important that we're pretty upfront with women about different methods of birth control, how they work, types of side effects that they may experience, so that they're prepared for those, and hopefully are making a very informed decision about the type of birth control they're using, and so that moving forward they will continue to use that method of birth control. Although certainly if a woman starts using a method of birth control and is having issues, having side effects, it's also important that she knows she can always go back to her healthcare provider and talk about accessing different methods of birth control that perhaps wouldn't have those same side effects. All right, and then finally, I just wanted to wrap this up with a few case studies. I will certainly give folks some time to just read through this and think about these different situations and what types of birth control you might talk to these different women about given their different situations. All right, and any thoughts, ideas, or questions that folks have, I would be happy to answer. You are welcome to give me a call or send me an email. My contact information was on the first slide of this presentation. But again, my email address is Meghan, MEGHAN, .Benson, BENSON, @PP, as in Planned Parenthood, WI.org. You're welcome to shoot me an email and ask me any questions that you have, or if you need any additional information or resources. And then I do just have a few other slides here, some additional resources around reproductive life planning. And at the very bottom, you can see there's some information about the Badger Care Program Family Planning Only services. If you are working with folks who don't have insurance or for some reason don't have insurance that would cover preventative family planning services like birth control and STI testing, this program will help low-income individuals access those services. Some additional resources include the Planned Parenthood website, Planned Parenthood of Wisconsin's website, bedsider.org, which is actually a really great website in particular for young adults. It really targets young adults. And the Association for Reproductive Health Professionals actually has this really interesting tool online that you can use where you have somebody answer a variety of different questions to help them determine which methods of birth control might work best for them. And then just a few selected references from some of the studies and statistics that I mentioned earlier in my presentation.